Hello everyone, today I'll be explaining about the ulnar nerve. I'll explain about its course, I'll explain about which muscles does it supply, and at the end I'll explain about an injury to it. What will happen to the muscles that it supplies. Okay, so I'll start by the course. So we all know that it starts from the brachial plexus, from the median cord. Okay, why is it the median cord? Because it's named median cord because it's medial to the axillary artery. Okay, so I'll just draw the brachial the axillary artery, and then below the teres major it will become brachial artery, and then when we will reach the ulna and radius, it will give two branches, radial artery and ulnar artery. So here we go. Right here, this is the axillary artery. Let's suppose that this is the level of teres major. We will go down. Here is the elbow. So at the elbow, the artery will split. Here's the radial part, and there's the ulnar artery. Okay, so now we know the orientation of the axillary artery with the brachial artery. It's all the same. So now we need to know where's the ulnar nerve in relation to it. Here's the ulnar nerve. Okay, it will move medial to the brachial artery. Okay, but at the level of coracobrachialis, let's suppose that this is the level of coracobrachialis. The nerve will pierce the medial intermuscular septum. Okay, so what is the medial intermuscular septum? I'll just give a draw. Here's the hand. This is a sagittal section, and a sagittal section of the hand, like if I cut it like this. Okay, here is, okay, this is anterior and this is posterior. This is medial, this is lateral. Okay, so the nerve just was in the anterior aspect of the arm, and it went through the medial intermuscular septum to the posterior part. Okay, so it will go back. The nerve will go back to the posterior aspect of the arm. I'll just draw some. Okay, and let's suppose that this is the medial epicondyle. So it went back and it will go behind the medial epicondyle. Okay. Okay, after that, what will happen? Here we entered the forearm. As we enter the forearm, the muscle will go in between, the nerve will go between the two heads of flexor carpi ulnaris. There are two heads of flexor carpi ulnaris, and the nerve will go between them. Okay, here is one head, and here is the other head. Okay, what's the muscle that's deep to the flexor carpi ulnaris? Yes, correct. It's the flexor digitorum profundus. So this nerve, the ulnar nerve, as the name suggests, flexor carpi ulnaris. So of course this ulnar nerve will supply the flexor carpi ulnaris. Okay, here is the flexor carpi ulnaris. Flexor carpi ulnaris. Okay. So now, we said also that the muscle that is deep to it is the flexor digitorum profundus. There is two parts of the flexor digitorum profundus. There's a medial part and there's a lateral part of it. The lateral part of the flexor digitorum profundus is supplied by the median nerve. However, the median part, which is the one deep to the flexor carpi ulnaris, is supplied also by the ulnar nerve. So here is the flexor digitorum profundus, or let me draw it like this. Right now you can see it like it's anterior, but in reality it's posterior or deep to the flexor carpi ulnaris. So the nerve will just go like this. It will enter to the page of the plane. It will enter to the plane of the page. Here is the nerve, and it will go back. This sign means that it entered deep. Okay. We will not leave the flexor carpi ulnaris because it's continuous. We will follow it till its tendons. Here is its continuation. Okay. Let me just do some modifications. Okay. So in the forearm, till now, what are the muscles that the ulnar nerve supplied? The flexor carpi ulnaris and the medial half of flexor digitorum profundus, which is deep to the flexor carpi ulnaris. These are the muscles in the forearm that this nerve have supplied. Okay. Now we will continue with the nerve. It will course down. Okay, it will then move lateral to the tendon of flexor carpi ulnaris. You see, it was in the middle. Now it moved lateral. Here we go. Here we continue it. Now it's lateral. Okay. Now it will give a branch. This branch will go to the hand. This branch that it will give now, it will go to the hand. And this branch is responsible for what? For the palmar aspect of the hand, and it's just giving sensation, cutaneous innervation, not motor. Here is the branch. Can you see it? Okay. This branch right here, it supplies palmar aspect of the hand. It is just a cutaneous innervation. I'll just draw the area that this nerve supplies. Okay, I'll draw the hand. Here is the hand. Okay, so this is the thumb. The thumb will number it 1, index 2, middle finger 3, then ring finger 4, and finally the small finger, little finger 5. Okay. So what does and this is actually the palm of the hand, not the dorsal aspect. Okay. I'll draw this branch of the ulnar nerve coming from up, supplying which area of the palm of the hand? Okay. It actually supplies the little finger, and no, it actually supplies the palm but not the fingers. I'll draw the area that it supplies. Okay, just a second. It supplies this half if we just did like this, it does not supply the fingers. It supplies this aspect. Let me just a second. Okay. This aspect of the palm. The fingers numbered 4 and 5 are supplied by another branch, but also from the ulnar nerve, but it's a different branch. The cutaneous sensation for the fingers, this finger and the half of this finger, yani finger 5 and half of finger 4, their cutaneous innervation is from different branch, but the palm below them, the part of the palm below them is supplied from the palmar cutaneous branch, which is this branch. Palmar cutaneous branch. Okay. So now we will continue the course of the nerve. I'll just keep the branch. Here's the nerve. Here's our main branch, or our main course. Yeah. Okay. Now it's lateral to the tendon flexor carpi ulnaris, and there is also something else that it's lateral to it. So right here we have the carpal bones. Here is the pisiform bone. You know the mnemonic? Sarah looks too pretty. Okay. So the pisiform is the most medial carpal bone from the first lane. So this is the pisiform bone, and the ulnar nerve is lateral to it. Okay. I'll continue. Before the nerve enters the wrist, it will give a branch, and this is the dorsal cutaneous branch. Okay, what does this dorsal cutaneous branch supply? I'll draw it. Here's the dorsal cutaneous branch. It will wind around the hand and go from the posterior aspect. Now it's supplying it's just a cutaneous nerve supply to the dorsal aspect of the hand. Okay, I'll draw the dorsal aspect of the hand. Okay, this image is for the palmar cutaneous branch. And we said this palmar cutaneous branch does not supply the fingers from the palmar side, but it supplies only the skin below them. Okay. However, this dorsal cutaneous branch, dorsal cutaneous branch, it supplies both the fingers and the skin below them in the dorsal aspect. Now I'll draw what it supplies. Okay. Here is the thumb. Here is the as we said, the index, middle finger, ring, and finally the little finger. Okay. But this is the dorsum of the hand. So what does this nerve supply in the dorsum? Okay, so this is 1, 2, 3, 4, 5. It supplies both finger 5 and medial half of finger 4 So this is medial, this is lateral. What do I mean by medial half finger for? Like this half, not the other one. Okay, so it supplies this part and this part downward to the palm. I mean at the dorsum. This is not the palm. This is the dorsum. Okay. So this is the dorsum of the hand, and it supplies both the fingers and the dorsum of the fourth and fifth finger. Okay. However, the palmar cutaneous supplied the palm, and it did not supply the fingers. You get my point now? So they are different. This supplies the palm, this supplies the dorsum. And until now, it's only cutaneous innervation. We didn't get into the muscles of the hand. Okay, here's our main branch. Okay, till now we still have two more branches, and these left, and these are these will be our motor branches. Okay, now this branch will split. These are the final two branches. Here's one, here is two. One branch, second branch. Okay. What does this branch supply, and what does this branch supply? Okay, I'll just rename them. This is one and this is two. This is better. Okay. And remember, this is a different branch. Let me just make it clear. This is a different branch. This is below. This branch is before we enter the wrist. So this is still in the forearm. Dorsal cutaneous branch still in the forearm. Okay. But the last two branches are now خلاص, we entered the hand, and both of them they give motor activity. Okay. First of all, we have the deep terminal branch, which is number one. This one is called deep. Deep terminal branch. Okay, let's discuss about this deep terminal branch. I write one, which means the deep terminal branch. Deep terminal branch. Okay. So this deep terminal branch supplies all the muscles of the hand. And when I say the muscles of the hand, I don't mean the muscles that came from the forearm and enter the hand. I only mean the muscles that origin in the hand and insert in the hand. So they don't originate from the forearm. They are only intrinsic muscles. Okay. So what does this deep terminal branch supply? It supplies number one, first and second lumbricals. Number two, the three thenar muscles. Number three, palmaris brevis. No. Let me just write them and I'll discuss about them. Okay, the deep terminal branch actually does not supply these muscles. The deep terminal branch supply all the intrinsic muscles of the hand except these. Even it supplies all intrinsic muscles of the hand except these, except the following. Okay. But when I say it supplies all intrinsic muscles of the hand except the following, that means that there's another branch that supplies يعني I don't mean like that the ulnar nerve does not supply these muscles. There may be another branch that supplies one of these muscles. Okay, so we have the palmaris brevis is supplied by another branch, which is the second branch, this one. Palmaris brevis supplied by this branch, number 2, which is the superficial terminal branch. Superficial terminal branch. Okay, what about those two? Okay, those two are not supplied by the ulnar nerve at all. Then they are supplied by what? They are supplied by median nerve. Okay, now let's discuss the muscles of the hand in order to make things more clear. Okay. Okay, I mentioned right here first and second lumbricals. What are lumbricals? What are their functions? هسا we said palmaris brevis supplied by superficial terminal branch, which is also branch of ulnar nerve. What about lumbricals? We said they are supplied by the median nerve. So, I mean, the first and second are supplied by the median nerve. However, third and fourth are supplied by the ulnar nerve. Specifically, the deep terminal branch. So it is supplied by this same nerve. But the first and second lumbricals are supplied by the median nerve. Okay, now let's discuss about these lumbricals. Okay, I'll draw the hand. Here's the thumb, index, middle finger, and we have the ring, and we have the little finger. Okay. What are lumbricals? Let me draw them. Lumbricals are found on the let me number the fingers. 1, 2, 3, 4, 5. Lumbricals are found on the lateral part of the, or lateral half of the second to fifth fingers. On the lateral half. So here's the second finger, here's the medial half, and here is the medial half, and here is the lateral half. So where are the lumbricals? Here is the lateral half. Here's the first lumbrical. Here's the second lumbrical. Here is the third one, here is the fourth one, but the thumb does not have a lumbrical. Only the second to fifth finger have lumbrical. So the first lumbrical corresponds to the second finger, the second lumbrical corresponds to the third finger, the third lumbrical corresponds to the fourth finger, and the fourth lumbrical corresponds to the fifth finger. Okay. The function of all of the lumbricals have the same function. Flexion. At the metacarpo, phalangeal joint and extension of interphalangeal joints. Okay, flexion at the metacarpophalangeal joints and extension of the interphalangeal joints. Okay, why do we need this position? If they told you, for example, in the exam, someone cannot hold a pencil. Okay, if someone cannot hold a pencil, in the writing, we usually, when we write, when we use a pencil or a pen, what do? We flex the metacarpophalangeal joints, but we extend the interphalangeal joints. When the lumbricals get injured or they don't get enough nerve supply, so we cannot flex, the opposite will happen. Yani. The metacarpophalangeal joints will be extended and the interphalangeal joints will be flexed. And this thing, we don't want it. We cannot use a pen or a pencil if that happened. Okay. Minutes ago I mentioned that the first and second are supplied by median nerve. However, the third and fourth are supplied by the ulnar nerve. Okay, so now we finished one part of the intrinsic muscles of the hand. We will go into all of the intrinsic or the most of the intrinsic muscles of the hand. Okay. We will discuss now the thenar muscles. And we said they are not supplied by the ulnar nerve, they are supplied by the median nerve. Okay, let me draw a hand. Okay, here's a hand. Okay, all the muscles that are supplied by the ulnar nerve, I'll draw them with green color, and the muscles that are supplied by the median nerve, I'll draw them with blue color. Okay. What are the thenar muscles? We have three muscles: opponens, pollicis, abductor, pollicis brevis. And finally, flexor pollicis brevis. Okay. Opponens pollicis, abductor pollicis, flexor pollicis. Okay. So, what is opponens these all of these muscles يعني are for the thumb, which is the first finger. So these are muscles of the thumb. Okay. So what is opponens pollicis? This muscle is responsible for this motion, opposition of the thumb. Opposition of the thumb. When we oppose the thumb with another finger. So for example, someone is holding a brush teeth with his index and his thumb, for example. He cannot hold it, so we suspect which nerve injury? Median nerve injury. If he cannot oppose his thumb. Because as we said, the thenar muscles are supplied by the median nerve. Let's give a like a general rule, which is almost always correct. All of muscles of the hand are supplied by ulnar nerve, except thenar muscles and first and second lumbricals. This is a very important rule. So any muscle that I will mention after that, all of these will be supplied by which nerve? Median nerve. I mean the ulnar nerve. Or any muscle that I'll mention after a while will be supplied by ulnar nerve. Because only the thenar muscles and first and second lumbricals are supplied by median nerve. Okay. Let's draw the intrinsic muscles of the thumb. And I'll draw them with blue, as I said. Blue means median. Okay. Here is opponens pollicis. Let me just make it clear. Opponens pollicis, abductor pollicis, flexor pollicis. All of these are supplied by what? By the median nerve. Okay. But this one is called abductor pollicis brevis. Okay. There is also another muscle that we took, which comes from the forearm. It's called flex. There's another muscle that flexes, which is the flexor pollicis longus. There's another flexor we took, which is the flexor pollicis longus, which was moving on the ulna. I'll draw the flexor pollicis longus coming from the ulna. Here is the flexor pollicis longus. Okay, now this muscle supplied by which nerve? I said this muscle is not an intrinsic hand muscle. It came from the forearm. So the rule we did right here does not work on it. This muscle is supplied by anterior interosseous nerve. Anterior interosseous nerve, which is a branch of median nerve. I just colored it red because it's not the median nerve itself, it's a branch of it. Okay. I could have colored it blue. It's still the same. Okay. However, the ulnar nerve is green. Okay, there's also another muscle of the thumb other than the thenar muscles. We said the thenar muscles are these three. 1, 2, 3. Okay. The red one is not. Flexor pollicis longus is not one of the thenar muscles. I'll draw another muscle. It controls the thumb, but it's not a thenar muscle. It is adductor pollicis. I draw it with green color because it is supplied by the ulnar nerve. It is an intrinsic hand muscle. It does not originate from the forearm. And it's not one of the thenar muscles, so it's supplied by ulnar nerve. Okay. As we said, all of the thenar muscles were supplied by what? By the median nerve. Okay. Let's talk about now the little finger. Which muscles can we find here? Okay. We can find three or four muscles similar to that of the thumb, but the muscles of the little finger are not first and second lumbricals, nor they are a thenar. They are different. So they are supplied by which nerve? The ulnar nerve. Okay. Here is the first, here is the second, here is the third. And there will be a 4 also. Opponens digiti minimi. Opponens, similar to that of the thumb, opponens pollicis, but here opponens digiti minimi. Abductor digiti minimi. Flexor digiti minimi. All of these are supplied by what? Supplied by, as we said, ulnar nerve. Do you remember what I mentioned minutes ago about the third muscle, this one, palmaris brevis? It's located under these muscles that we mentioned right now. So we said this palmaris brevis is supplied by a branch of the ulnar nerve, which is not the deep terminal branch. It's supplied by the superficial terminal branch, which is number 2. Okay, this nerve, number 2. Here we can find that. I'll draw the palmaris brevis. Here is palmaris brevis. Okay, what's the function of this muscle? Okay, the others we know, yeah. Opponents, we do opposition of the finger with other fingers. Abductor, what do we expect? Abduction of the finger. Flexor, flexion of the finger. also similar to the thumb, same functions. And here the flexor pollicis longus, also flexion of the thumb. Okay, palmaris brevis. The palmaris brevis, as we said, is supplied by superficial terminal branch, and it acts just makes tension below the little finger, just makes tension, and it connects it to the surrounding connective tissue to make it more stable and tough, and not like elastic. Okay, we still have the last muscles that we are going to talk about, which are the interossei. We have two types, palmar interossei and dorsal interossei, and each of them perform different functions. Okay. I'll draw the hand again, once again. Okay, that's so dumb. Okay. The interossei. The palmar, let's start by the palmar interossei. Palmar interossei perform which function? Adduction of the fingers. Adduction of the fingers. Okay, now you will ask yourself, so when we do adduction, the middle finger, how will we know that if it does adduction or abduction? We don't know. It cannot, we cannot say if this is adduction or abduction because there is no central axis. So in this case, what do we always do? Always the middle finger is the axis. So middle finger can abduct, go away from the axis, but can it adduct? No, it can't, because it is the axis itself. So do we expect, so this finger does not undergo adduction, so do we expect any palmar interossei on the middle finger? No, because we don't do adduction to the middle finger. So where can we find the palmar interossei? Here is finger number 1, 2, 3, 4, 5, and as we said, the middle finger, there is no palmar interossei. For the thumb and the index, it will be on their medial aspect. Okay. Why is it in the medial aspect? Because when they adduct, they are going to move to the right, like this, to the medial side. What about the little finger and the ring finger? The palmar interossei will be on their lateral side, right here and right here. See, we didn't put it right here or right here, not on the medial side, on their lateral side, because they are going to move to the axis like this. So the palmar interossei adduction. So the palmar interossei adduction, what do we expect from the dorsal interossei? Abduction, abduction. Okay. The dorsal interossei. abduction. Okay, let me ask you a quick question. هسا عندنا هسا الثumb والlittle finger, each one of them has his own abductor. See, the little finger abductor digiti minimi for the little finger abductor digiti minimi. For the thumb we have what? The abductor pollicis brevis, and as well as abductor pollicis longus. As we said, we have flexor pollicis longus. We also have abductor pollicis longus, but it's on the dorsal. It came from the forearm as an from the extension on the dorsal aspect of the forearm. Okay, so they already have something to abduct them. So will they need a dorsal interossei? No, they don't, because they already have an abductor. Why would they need a dorsal interossei to abduct them? So where are the locations of the abductors now? Okay, dorsal interossei. Let me draw the hand once again. Just to recap, I'll just emphasize on the palmaris brevis is supplied by the which branch? Superficial terminal branch of the ulnar nerve. Okay, so we do an X on the thumb and the little finger. We have now three fingers. As a middle finger, we said we cannot abduct it, but abduction, we can abduct it. We can move it away from the middle axis. We can move it to the right and we can move it to the left. Okay, the middle finger has two abductors. The middle finger have two abductors on its both sides, to move it like this and to move it like this. What about the other two fingers, the index and the ring? They have, each one of them have one abductor. Okay, that moves them away from the axis. And these are the dorsal interossei. The palmaro-dorsal interossei are innervated by which nerve? Ulnar nerve. And they are intrinsic hand muscles. Okay. Remember when we said that the palmar cutaneous branch does not supply the fingers? Then what supplies the fingers from the palmar aspect? Okay, the nerve that supplies this is the superficial terminal branch. This one, number 2, which also supplies palmaris brevis. This one also gives the cutaneous innervation to the palmar aspect of the 4th and 5th fingers. So I'll draw what I mean by this. Here is the hand. Okay, we have this nerve, which is superficial terminal branch. supplies what? Palmaris brevis. Palmaris brevis. And oh, this is the palm of the hand, and this is the 5th finger, and this is the 4th finger. Here's the thumb, 1, 2, 3. Always thumb is number 1. Okay, 4th finger, medial aspect of it. Okay, here, and 5. This is what? This is the superficial terminal branch that gives the fingers their cutaneous innervation, their sensory innervation. The 5th and half of the 4th fingers. Okay. So let's think of an injury to the ulnar nerve. Let's think of an injury to the ulnar nerve. Okay, let's say that the injury can occur due to fracture where of the medial epicondyle. What we said, the ulnar nerve crosses behind the medial epicondyle. So if a fracture happened here, the nerve will be injured. What could happen? Medial epicondyle, epicondyle fracture. Ulnar nerve injury. What will happen to the patient? Okay. First of all, the patient will lose the palmar cutaneous innervation. يعني he will lose what? The sensory innervation in his 5th and 4th fingers, and the both dorsal and palmar aspect. يعني the sensory loss will be on all of this part. Okay, here is the okay, let me get. So all of this sensory innervation will be lost, and this is the palm. What about the dorsum? Okay, the dorsum هاي الدورسال cutaneous branch هاي طالع ايش before the wrist، فأي injury هون كل هيخرب كل اللي تحته، يعني برضو الدورسال cutaneous branch راح يتأثر. dorsal cutaneous branch will be affected. حتى الدورسم sensory innervation also will be lost. هاي dorsum high 4th, high 5th, high 4th, high 5th. All of this side on the dorsum and on the palm will be loss of sensation in this part, from the dorsal side and from the palmar side. So the patient will come complaining of loss of innervation, the half of the 4th and the 5th finger, the whole 5th finger and half of the 4th. Okay. What about the motor function? So we said that the ulnar nerve innervates flexor carpi ulnaris and flexor digitorum profundus. What does flexor digitorum profundus do? So يعني damage to the nerve, we will have loss of nerve supply to the flexor digitorum profundus. And the medial half of the flexor digitorum profundus. So if this is flexor digitorum profundus, this is medial. This is lateral. The medial will be affected because the lateral part of the flexor digitorum profundus is supplied by median nerve. Median nerve. هسا المسل as a whole, المسل as a whole اللي هي flexor digitorum profundus, its function is to flex the medial four fingers. يعني هاي واحد، هاي اثنين، هاي ثلاثة، هاي أربعة، هاي خمسة. هاي medial four fingers، هاي اثنين وثلاثة وأربعة وخمسة. At the distal interphalangeal joints، هاي distal interphalangeal joints it will flex them. But if we said that the injury is in the medial side of the flexor digitorum profundus, so we have these four fingers, don't ignore the thumb, we don't care about it now. We have these four fingers, 2, 3, 4 and 5. If the damage is in the medial side of the flexor digitorum profundus and not the lateral side, so which is medial and which is lateral, we will do a split right here. This is medial, this is lateral. So what will happen? The fingers number 2 and 3 will not be affected because they correspond to what? To the lateral side of the muscle. However, 4 and 5 will be injured because they correspond to the medial side. We said medial side, ulnar nerve. Lateral side, median nerve. Okay? So if the ulnar nerve is damaged, this means the medial part will be affected, and thus the medial fingers in this case will be affected, which are the 4th and 5th fingers. So what will happen? The 4th and 5th fingers cannot be flexed at the distal. They can't be flexed at the distal interphalangeal joints. Okay, they cannot be what? They cannot be flexed at the distal interphalangeal joints. Okay. What also will happen? We talked about the palmar and dorsal interossei, and we said that both of them are supplied by the ulnar nerve. So in this case the patient cannot abduct nor adduct the fingers. The patient cannot abduct nor adduct the fingers. And also there is another thing. Okay, what do we also expect in the patient? As we said, he cannot flex the 4th and 5th fingers. He cannot flex the 4th and 5th fingers at the distal interphalangeal joints. Okay, what about, we mentioned the lumbricals, right? We said that the 3rd and 4th lumbricals, which correspond to the 4th and 5th fingers, what will happen to them? The 3rd and 4th lumbricals, هاي 3rd, هاي 4th lumbrical, هاي 1st, هاي 2nd. 1st lumbrical, 2nd lumbrical, 3rd lumbrical, 4th lumbrical. هسا الفيرست والسكند supplied by median nerve. The third و fourth supplied by ulnar nerve. فبالulnar nerve injury هذول الثيرد والفورث lumbricals اللي هم موجودين على الفورث والفيفth fingers will get damaged and will not work يعني properly. So what was their function at the beginning? Third والfourth lumbricals. طبعا ignore the first والsecond, as we said they are median nerve ما لنا علاقة فيهم. الدمج هسه بالulnar nerve يعني ما حيتأثروا second والthird fingers. هذولا second والthird fingers we ignore them ما حيصير لهم إشي بحالة اللامبريكالز. بس third والfourth اللي قصدي الفورث والفيفث fingers اللي هم عندهم third والfourth lumbricals اللامبريكال كانت الفانكشن تاعتهم flexion at the metacarpophalangeal joint and extension at the interphalangeal joint اللي هي قلنا writing position. تمسك القلم you extend the metacarpophalangeal, you flex the metacarpophalangeal and extend the interphalangeal. But in the case of injury, the opposite will happen. The person will get extended metacarpophalangeal joint and flexed interphalangeal joint. So what will we get? Here is the thumb, here is the index, here is the middle. We said that nothing will happen to them, but these two fingers, extension of the metacarpophalangeal, they are extended. Hey, extension. Let me extend them. Hey, هم extended. هاي الميتاكاربوفالنجال joints they are extended and flexion of the interphalangeal joints. flexion of the interphalangeal joint. طلعوا كيف صار عندنا الهاند. مش هي اسمها ايش؟ كلو هاند. هايها كلو هاند. طبعا هذولا الفينجرز تاني second والثيرد مشكلتهم الوحيدة بس انهم ما بيقدروا يعملوا لا adduction no adduction no abduction عشان البالمر والدورسال انتروسياي. بس هذول التو فينجرز اولا loss of flexion of distal interphalangeal joints او مش complete loss يعني احنا مش شايفين اللي بالكلو هاند هيو هذول الديستال انترفالنجيال صاير لهم فليكشن. صحيح صاير لهم فليكشن بس مش فليكشن قوي مش زي الطبيعي يعني انه مو complete loss. فشو سبب حكينا الكلو هاند؟ المشكلة هون في اللامبريكالز انه extension of metacarpophalangeal joint و flexion of interphalangeal joint. تمام. What do we have also? We mentioned above about a muscle. هاي المصل الخضراء ايش اسمها؟ adductor pollicis. هاي adductor pollicis هاي. طيب هاي مالها؟ هاي قلنا it's not one of the thenar muscles, so it's not supplied by the median nerve. في طوالي it's supplied by the ulnar nerve. لما this get damaged معناته الثumb cannot be adducted. هي adductor pollicis, so it adducts. So the thumb cannot be adducted, it will be permanently abducted. The thumb will permanently abducted. Okay. And finally, as we said, loss of sensation in this area. كل هاي loss of sensation, you cannot feel because we lost sensory innervation. sensory innervation كان جاي من أولا palmar cutaneous branch supplied the palm of the hand that corresponds to the the fifth and half of the fourth finger. And حكينا الدورسال cutaneous branch we lost it. حكينا superficial terminal branch اللي هي supplied dorsal aspect of the palmar aspect of the fingers. هم 3 nerves, 3 branches to supply this area. We completely lost it. So if a patient come to you with the following, you diagnose ulnar nerve injury, loss of sensation in this area, no abduction, no adduction of all of the fingers, but you can see it more in the on the second and third fingers, and permanently abducted thumb, problem في اللامبريكال كمان، عملت لنا الكلو هاند لانه اللامبريكالز وظيفتهم الطبيعيه flexion of metacarpophalangeal extension at interphalangeal، بس هون صار العكس extension of metacarpophalangeal flexion of interphalangeal. Okay, thank you very much.